evening, everyone. Thank you, Ashley, for that warm welcome. And tonight I will be presenting my TED Talk on a vaccine to prevent cancer. So as you all are suspecting, I'm talking about HPV, the human papillomavirus. And just to give you all some background and significance about HPV, it's the most commonly sexually transmitted infection in the United States among all other STIs, with half of all new incidences reported in individuals ages 15 to 24. HPV is commonly associated with many genitourinary cancers, primarily those of the cervix, which are most prevalent in women, but has recently also been associated with many oropharyngeal cancers, which is most prevalent in men. So as you all know, they have the HPV vaccine Gardasil out there that's usually offered during adolescence to prevent infection or prevent exposure to non-commonly transmitted strains of the HPV virus. However, the HPV vaccine rates are not looking too good, with only 6 out of 10 girls who actually started the vaccine series, and that's defined as receiving 1 or 2 doses of the series, and only 5 out of 10 boys that actually started the series. And as you can see, many of these other states are well below the national average. So in my quest to understand what's going on with these vaccine rates, I decided to explore the association between parents' knowledge about HPV and their intentions to have their daughters vaccinated against it. So in this, I did a secondary data analysis using the 2006-2007 HITS national data set. And the reason why I used an older data set because it was the only one that had the main outcome variable of interest, which was intentions to vaccinate. And because of the published year of 2006-2007, the HPV vaccine was only offered to girls at that time, so that's why I limited it to just daughters. But since then, it's for everyone. So from my study, I found that many parents reported that they were knowledgeable about HPV. However, a little over half actually had intentions to vaccinate. And then using bivariate analysis, I noted that there was differences by age of the parent and also their income in terms of intentions to vaccinate their daughter. And then using multiple multinomial logistical regressions, I found that parents who reported that they were knowledgeable about HPV were actually nearly 4 times more likely to have intentions to vaccinate their daughters. And this is also for controlling for other variables in the study. So from my study, I found that being HPV knowledgeable was strongly associated with intentions to vaccinate their parents who had daughters. And it served to have 3 implications. So the first implication was to think about, for us as nurses or any other healthcare providers, to actually implement some type of educational programs in high-risk communities or in the school systems for parents to get more knowledge about it. And at the practice level, we as healthcare providers should go beyond just handing over the CDC information vaccine sheet to parents and actually sitting down with them and seeing what they know about HPV. That way we can address knowledge gaps and also build upon their knowledge base. And lastly, at the policy level, stakeholders should consider administering or having the vaccine administered in school systems in all 50 states. Some states are currently doing this, but not all states are on board. So I believe with the educational programs in the school system and actually having an option for parents to vaccinate their child in the schools will help to improve vaccine rates.